So we actually are on the cusp of seeing maybe the beginning of single payer healthcare. And what's incredible about this, and I love it, is that the start of single payer healthcare might actually be under the guise of something that conservatives love, the power of the states. You guys know, we always hear about conservatives say states should decide, the power of the states should have the power, and they cite what our founding fathers would want. They claim that our founding fathers would be rolling over in their graves. I find it totally disingenuous. Anytime, left or right, conservative or liberal, people start talking about what the founding fathers would be thinking about a specific bill, I hate it. But what I love is that Vermont is actually saying, you know what? We're going to propose, and it's already passed one house and it needs to pass the other side, a single-payer healthcare system in Vermont. It's going to start as a government-run health insurance exchange with the specific goal of switching over and being a single-payer healthcare system. And you know what? When we actually survey doctors about this, even though conservatives will tell you, you're not going to get doctors to work under that system, so they won't get paid, it'll be a mess. Actually, the latest poll shows about 60% of doctors would prefer to work under a single-payer healthcare system. I guess maybe doctors don't really want to just push paper and be doing, and they actually want to help people. They actually want to practice medicine. They don't necessarily want huge billing departments that have to handle medical billing codes and so on and so forth. They actually want to have the hospital doing medicine. It's incredible. Who would have thought? And you will hear conservatives say also, well, you know what? People aren't going to get the care that they deserve. People aren't going to get the care that they need. And even if this is successful, mark my words, even if this works in Vermont, I already know, we all should know what conservatives will be saying. They'll be saying, well, Vermont's population is so low. Vermont has a population of under 1 million people. Just because something works in Vermont doesn't mean it's right for the whole country. So prepare yourselves, because this is not going to be an easy battle. Even during my lifetime, I am still skeptical we will see any kind of significant national single-payer healthcare system. But Vermont is doing it the conservative way, power of the states. So keep an eye on that. And when people tell you we can't afford it, people tell you Vermont can't afford it, just remember, GE paid no taxes last year. We claim to be broke, even though GE actually got a tax benefit. The healthcare system as it is wasting a ton of money. And we always have money for wars, right? I mean, we see it in Libya now. We were never short on money for Iraq. That money was always there. Whether we gave the troops all of the protection that they deserved, well, that's a different story. But the money always seems to be there. And let's face it, the U.S. is the only country at our level of development in the world that has this heinously outdated, ineffective, wasteful, for-profit healthcare system. Vermont. It all starts with Vermont.